Call this Health Committee meeting to order. Servants, and to also be thankful for the provisions you've made for the Cherokee Nation, allowing us to have resources to render health care to our citizens. May we never lose sight of that this is a blessing from you. Pray you be over our meeting today, that everything we say and do be pleasing to you in Jesus' name. Amen.
Mike Dobbins. Dora Patzkowski. Keith Austin. Danny Callison. Julia Coates. Sean Crittenden. Joe Deere. Rex Jordan. Johnny Kidwell. Darrell Legg. Wes Snowfire. Joshua Sam. Mike Shambaugh. Melvina Shophouch. E.O. Smith. Candessa Teehee. Victoria Vasquez. You have a quorum.
Thank you, Gail. Have you had time to look at the minutes? If so, I'd entertain a motion to approve the minutes.
Second.
All those in favor? Aye. Any opposed? Thank you. Motion passes. Okay, before we go into reports, I did set at each one of you at the desk about a pain management project ongoing. It's not going to be an agenda item today, but on the announcements part, I'll just briefly kind of talk about what that's about and what the tribe's involvement is. But before, this first report is from George Vallier from Claremore.
Good afternoon.
Hello, George.
What I'm passing around is, I forgot to include it in our, report that I send in. It's the dental services, list of dental services. I think somebody asked for that last time. And so I wanted to present that to you guys so you'd have that. As of Friday, we are mask optional at the hospital now. They're still available, masks and gowns, but they're optional. Up until then, it was still mandatory for all staff and patients. We have all the testing that was being done out front. Thank you. All the testing that was being done out front in the drive-through, it's dwindled now. I think they said we're averaging about 10 to 12 tests a day out there, so we're pulling all that testing back inside. So there won't be anybody out at the drive-through. We had two of our pharmacists were recognized at the Oklahoma City Area Pharmacy meeting as junior pharmacists of the year. That was Lieutenant Commander Kristen Young and Lieutenant Taylor Morris. It's quite an accomplishment for those two officers. We partnered with the Rogers County Health Department and the Rec Center and hosted an employee health day there in the lobby at the hospital. We've had our nursing leadership attended the 20th annual evidence-based practice symposium presented by the University of Oklahoma College of Nursing, doing some things with them. And then the Claremore Indian Hospital Diabetes Education Program partnered with Cherokee Nation Community Health Nursing, Cherokee Nation Public Health Education, and Rogers County Public Health to host a diabetes alert walk there at the hospital. That was really successful, and we had a really good turnout for that. But some of the things we've got going on there, visits are up, collections are up, things are going well there. And we still have, along with the dental services list that was passed out, we still have 2 vacancies for dental assistants. I don't know why we're having trouble recruiting assistants, but we still have two vacancies there. Any questions?
two's down from quite, you were up around needing 6, 7, weren't
Yes.
you?
Yes, sir.
Questions for George? George, I appreciate the list you have outlining the dental services offered at Claremore Indian Hospital. Under pediatric dental, do you have a full-time pediatric dentist?
Yes, sir.
One?
Yes.
Okay. Those are hard to find, by the way.
They are. In fact, we sent him to school. He's a commissioned officer, and we got him trained as a pediatric dentist, and so he's going to stay there for a while.
Just kind of FYI, pediatric dentists are hard for Cherokee Nation to find. They're in high demand.
They are.
Got to learn how to wrestle kids and do dentistry at the same time. It's quite a skill set. Okay, George, thank you.
Thank you.
Up next, normally we'd have Dr. Steve Jones, but pinch hitting is Deputy Executive Director, Mr. Wayne Caldwell.
Thank you, Council, for having me here today to report for Health Services. One quick note, I did want to say happy late Mother's Day to all you mothers on the Council here. A few highlights from the submitted report. If you don't mind turning to page 4 with me. On top of page 4, the Health Committee report. Underneath that, it says provider recruitment. I think on this page, there's 2 things I would like to highlight that are important to our health system. The provider recruitment is 10%. We have a 10% vacancy rate for our health system. I think kudos should be given to our recruitment team and our retention efforts throughout the health system to maintain such a low vacancy rate. We pride ourselves in being below any benchmark that is a national standard that's set, which you can see beside the vacancy rate on the report. Secondly, I wanted to highlight the referral approval rate, 95% approval rate. Just as a reminder, on a monthly basis, on average, we do process around 12,000 contract health referrals, and 95% of those 12,000 were approved for that month. That is a great approval rate. A couple of items that aren't on the report that I wanted to highlight. Last week, we took part in National Hospital Week. Throughout the week at W.W. Hastings Hospital, we had various events going on. We brought in vendors to provide a warm lunch for all staff, whether day or night shift. Just another little note, later in the year, we will highlight National Outpatient Health Center Week. Again, that comes later in the year, and we will do that for all of our outpatient clinics across the reservation. So more to come on that. In conjunction with National Hospital Week that took place last week was Nursing Week also. And nursing leadership threw together a great week of Spirit Week that met appropriate standards for healthcare. Had a lot of fun with that, and they also did giveaways throughout the health system to honor our hardworking nurses throughout the health system. Today we kicked off our inpatient dialysis. We've been working on this for many months. For inpatient dialysis, there's a lot of testing that goes on. In particular, the water has to meet a certain criteria prior to adding the service line. We've been building policy and procedures also for this service line. Again, you must meet inpatient criteria to be available for this inpatient dialysis. Salina groundbreaking. I hope you all are able to join us this Thursday, historic day for us in health services. I wanted to say thank you all for approving the legislation signed by the chief and deputy chief to make this happen in Salina. They set aside $440 million for health care and capital improvement projects, $400 million for the W.W. Hastings Replacement Hospital, $40 million for Salina Health Center, and then $5 million for the NSU Optometry School. Mr. Chair, I have nothing more to report. I'm available for questions.
Joe?
Hey, Wayne, how are you?
Good.
Hey, I was just going back through the notes from 2019. You guys were discussing a reorg, and I was wondering, did that ever happen? I know we got hit with COVID and all that. Did we just put a stop to that, or where are you guys at on that?
Great question, Counselor. Thank you. We have, this is an ongoing effort. You know, as you can imagine, in health services, I think the last statistic I saw was around 2,700 employees that we have. That is a great undertaking, and we are making strides on that every day, along with the help of human resources in the tribe.
Okay. So would you say you're like half done with the reorg, or where you at?
Let me report back to you on that.
All right, thanks.
Thank
That's
you.
all I have, Chair.
Good, Joe. Candace?
Good afternoon. Thank you for joining us this fine afternoon. I don't really have a question, but when you were highlighting the referral rate, I had a handful of incidents with contract health where I needed to interact with the employee, Steve Carey. And he was just an absolute gem, a real treasure. I think I sent him one email and he replied back within about 5 minutes, apologizing for the delay. So he was able to reach a satisfactory resolution on that handful of issues that I brought forth to his attention, and did so very quickly. And we were able to get those citizens' needs met. And so I just wanted to take a moment during your report to brag on Mr. Carey, because he just is really outstanding at what he does.
Thank you for that, Counselor. I will pass along that message.
I appreciate it. Thank you for the time, Chair.
Victoria?
Yes, thank you, Chair. Wayne, thanks for being here. I had a question regarding something the council voted on in 2012. We voted to set aside 5% of business dividends to supplement health care services, such things like contract health and dentures and eyeglasses. And I was wondering if you could provide us how much the 5% health fund has generated since 2012.
Absolutely, Counselor. Thank you for the question. Yes, I can. We actually just reviewed this within the past few months. The approximate breakdown, and I will give you all a report that you can have that will break it down by year, but the approximate is $112 million since its inception, since 2012. 2012, $112 million to date.
That's great. Thank you very much.
Thank you.
Thank you, Chair.
Dora?
Yes, Mr. Caldwell, I was wondering, do you know if Cherokee Nation Healthcare is turning down any cancer patients? How is that going?
Counselor, thank you for the question. I think, this is an important item to the contract purchase and referred care, or you can say Cherokee Nation Health Services in general, or anyone. Cancer care is a priority item in purchase and referred care, and they are always approved. Now, you may run across a constituent that may not meet the purchase and referred care guidelines from the initial referral that went in, but we always work through those. If you have particular instances that you have questions about, I would gladly walk through those. But they must meet the criteria of the purchase and referred care that is set by our funding agency there.
Thank you. Thank you,
Welcome.
Chair.
Mike?
Well, I just wanted to say that, man, that's pretty impressive, that number, that 5% brings back the nation. And it's exciting in that, anytime a tribal council can support something like that, down the road shows such a big help to our people. Man, that kudos to the 2012 people who were here. That's a big deal.
Anybody else for Mr. Caldwell? Okay, thank you, Wayne.
Counsel, if you ever need something, just please reach out via phone or text or email. Thank you.
Okay.
Thank you, Mr. Chair. It's good to see all of you again. It's been a bit. Just about ready to take these barriers down, but not yet. So a few highlights from our report this month. I don't know everything that Lisa shared with you on the Working Together project that we're doing. That's a cross-sector group within Cherokee Nation that's been meeting. And one thing that's been elusive in the literature throughout the world is what's the definition of indigenous wellness? And so for Cherokee Nation, trying to figure out how do we define what a healthy Cherokee community looks like. And and how do we measure it, right? Because it has to be something we can measure. So working throughout the different departments within Cherokee Nation, we've been meeting for over a year, working with facilitator to define that. We're getting really close, and it's very exciting. And I think two things that were remarkable is learning, me as an epidemiologist, is learning how much data is available throughout Cherokee Nation that we don't share with each other. And then also watching the other executive directors learn how what they do affects health or wellness, right? So when the roads department builds a park, right? And I live very close to Hulbert, and I see the water park that's there, how that changes a community. And it's really remarkable. So very excited about that initiative and Lisa's leadership and Cherokee Nation's leadership through this. So with our goal of making healthy Cherokee communities, we have to figure out what that is, and the communities are participating with us to figure that out. Another exciting thing happening is our reaccreditation for the Public Health Accreditation Board. Should be any month now. All the documents are in, and we're just waiting for a site visit to get that done. As you recall, Cherokee Nation was the first tribe to have an accredited public health department, which we did about 5-6 years ago. And we've become, and really Lisa's become a national leader in tribal public health, and we're reaching out to other tribes and helping them achieve that as well. Ms. Pivik's been appointed to the board of the National Association of City and County Health Officials, a giant national public health group, and it's quite an honor. She's also been invited to join the executive board of the Public Health Accreditation Board. They're representing tribes and their efforts to become accredited and what that means for tribal, to have a tribal public health department, what that really is, because it's different from a county or a state. So know that Cherokee Nation is very well represented throughout the nation in public health. It's really cool. The other thing that's really impressed me is our community health worker program. You know, the Surgeon General last week or the week before put out an advisory on our epidemic of loneliness and isolation. And it's science, right? The data's there and the data's hard, and it's very moving. If you have a chance to read that report, it's available online. And the introduction is 20 pages long, and it'll run down all the basics for you. But to know that we have a core of Cherokees from the community who either are speakers or grew up in a household with speakers that are taking care of our elders every day. They have a panel, just like a primary care physician has a panel. They have panels of people that they check on, our elders and our speakers. And then remember, too, we have a whole army of public health educators that are out in our communities interfacing with the schools and the municipalities and the governments there to make Cherokee Nation a healthier place for everybody. So when earlier in my career I was doing a lot of global health and kind of globe-trotting and doing that, I was taught that you can measure a government by the way they take care of their most vulnerable population. And that is our elders, pregnant women, and children. And you look at what Cherokee Nation is doing for those three groups, it's tremendous. So proud to be a part of Cherokee Nation Public Health and part of Cherokee Nation to do this work. That's all I had on my list. Be glad to take any questions.
Questions for Dr. Gann?
Yeah.
Okay, Junior.
What should be our response when the elders call and ask about a COVID booster, if they should take it in the fall, or what we just tell them, to go on to the clinic and talk to them, or?
Well, the current recommendation from CDC is that if you're 65 years or older and it's been more than 4 months since your last shot, that you should get a booster. If you are immunocompromised, like someone undergoing cancer treatment like that, if it's been more than 2 months, then you should get another shot. That's recommended. So they can go to the clinic and get that done. Yeah, and those are still evolving. I don't know for others when the recommendation is going to come out. They're still watching. The COVID numbers are dropping like a rock, and we don't know if it's going to become seasonal like the flu, or it's just going to stay gone, or really what's going to happen. So we're tracking that. The data's kind of dried up. CDC is kind of not reporting as much as they used to, as well as the state health department. But if you look hard, you can find it. We've got a team of epidemiologists that are keeping an eye on things. mean, just 6 weeks ago, 300 people a day were dying from COVID. And that's like a big airplane full of people crashing every day. It's quite a bit. And now we're just below 50 a day. And it's trending down, so it's all good news.
Okay, thank you, Dr. Gann.
Yes, sir.
Okay, I see no old business pending or new business pending under announcements. I thought I'd briefly explain the sheet I left there in front of you, and it was just says a study of Native American pain risk, and it's headquartered at the University of Tulsa, and if you read there, it says the Cherokee Nation approved this study, so I didn't know from myself, but I guess we have a research arm within our health services. Dr. Kahn, K-H-A-N, I asked him to at least give us a summary of what he felt like this study entailed. And so you have that in front of you too, as to his expert analysis on what this study does at the University of Tulsa. And if you look there, they incentivize in participation. Juniors already noticed they give away $425. So he's signing up, and I'm just teasing. But they incentivize participation, and but anyway, I had our research with led by Dr. Kahn to enlighten us a little bit about this study, and maybe down the road it might be an agenda item we might bring forth and discuss. Also, I just want to announce that Kansas City University of Medicine opened doors roughly 8 years ago in Joplin, and which is about 130 positions annually. So maybe next health committee I might summarize how many medical school positions there are for our citizens within an hour drive or 2-hour drive of the reservation. The numbers are staggering now compared to what they were just 15 years ago. And I guess they're having a ribbon cutting for their dental school. There'll be a new dental school in Joplin opening July 1st. And I intend to be for the ribbon cutting for that. So that's the first dental school that's opened in the Midwest about 25 years. Dental schools are very expensive to construct and to operate. But a lot of things going on in the healthcare world. Okay, any other announcements? Okay, I'd entertain one more motion. All those in favor? We're adjourned.